The annual meeting is really important each year. It gets the community of nurses together for educational purposes. This meeting is an integral part, really, of a nurse's education in bone marrow transplantation.
I think we need to start thinking out of the box about long-term survivorship, and we need to stop thinking that we are in charge.
Now let's hear from John. John, how is this meeting going for you?
So far, fantastic. We had a really good opening session yesterday for the Nurses Group. It's our 35th meeting of the Nurses Group here at EBMT in Frankfurt, a fantastic city. We've had a really good welcome here. Hospitality has been great.
How important to the Nurses Group is the annual meeting?
The annual meeting is really important each year. It gets the community of nurses together for educational purposes. This meeting is an integral part, really, of a nurse's education in bone marrow transplantation. And we try to aim this meeting at our junior and mid-level nurses. And the idea is the education that is supplied here is enough for them to take back to their departments and allow them to expand their knowledge in their own workplace. But we're giving them tools here and ideas for them to be able to take home.
And what impact does what happens here have on the next 12 months?
For the next 12 months, it's really important. We have a variety of other meetings. So we have a paediatric meeting, we have a graft versus host disease meeting, we have an international study day, we have a research nurses day, which has now only been going for 4 years. So it's a really new development for us. And within this research nursing day, each year people bring along ideas, which are then brought to fruition over the next 12 months. And the meeting here each year gives people more ideas to bring back each year to EBMT. And we continue to educate our nurses.
Well, I'm delighted, John, we'll be seeing much more of you through today's programme because we're going to be sending you out to meet some of the exciting speakers.
Yeah.
So who are you going to be talking with first?
So I'm going to meet Hélène Schoemans later on today, who's going to give us a fantastic presentation about the late effects of transplantation.
Fantastic. Well, we'll look forward to hearing from you more later. Thanks, John.
Great, thanks.
I have first time here. Yes, this is a good time for meet another nurses around the world.
There's a lot of experience worldwide that we can bring back to our department, so it's important, absolutely.
We are more closer to the patient, so we can share the information with the patient in another way the doctors do.
I'm a nurse practitioner from Western Australia, and how else do we manage to keep ourselves up to date, especially in a global spectrum? The best way is to come to global meetings like this.
I believe that it is high time to put our patients in the driving seat.
Why should we as nurses and our patients indeed be concerned about long-term survivorship?
Well, I think, we're transplanting more and more patients, and these patients are surviving better, and we know that a number of things are going to jeopardize this long-term survivorship. And so what I wanted to give nurses is tools to recognize what is important for survivorship, typically chronic GVHD, subsequent malignancies, and cardiovascular problems.
What problems do patients tell you in your clinic that are important to them, and how can we help them with these problems?
Yeah, it's interesting to know that what we pick up as main signals and main problems after transplant are very different from what patients are actually telling us. Patients are telling us they're tired, patients are telling us they have financial concerns. They are not really depressed, but they are upset with not being back to normal. And I think we need to start thinking out of the box about long-term survivorship, and we need to stop thinking that we are in charge. And if we can give those tools to the patient and put him in the lead, in the driving seat, and help him know what he has to look out for, he doesn't need us anymore.
So you're speaking at the nurses session tomorrow on assisted dying, and I'd like to ask you a couple of questions about your presentation tomorrow.
Go ahead.
Can you tell me what assisted dying in Canada means?
In the spring of 2016, federally across the country, legislation was passed to make assisted dying accessible to all Canadians, with some caveats as far as eligibility. But we had a very short time within which to come up with local policies and procedures and ways to be able to provide that to patients. It's very rare that a patient would say, I'm looking for medical assistance in dying.
Yeah.
They often will say things like, how much longer is this going to go on? What's the long-term outlook for me? I can't do this anymore. There's lots of verbal cues that we really have a responsibility to hear. And once we hear those, it's important to go a little deeper into that conversation and understand what it is that the patient's asking for.
And what impact has this had on you and your staff?
One of the reasons that I'm doing the talk actually is because I had a patient after transplant who relapsed, who then went on to ask for medical assistance in dying. And I had known about the legislation and participated on panels, and I thought I understood where I stood.
Yeah.
But then when it became personal between me and a patient that I'd known for over a year, it became very, very difficult for me.
Are there things that you would change, or are there things that you would do in a different way?
The day that she requested this, I was not at work. If I had been the one to see her that day, I don't know if I would have picked up on those cues and asked her the question. And she may have missed out on the opportunity to sort of get that ball rolling. So I think from a reflection point of view, that's where I spent a lot of time. How many patients have I seen that might have cued me that I should have asked more questions and I didn't? And I think my practice has changed because now I do.
EBMT TV is brought to you from the 45th annual meeting of the EBMT in Frankfurt, Germany. For more like this, then you can click on some of these great videos. And don't forget to subscribe for more of the best in medicine, from cell therapy to gynecology, from genetics to psychology.